In the far southwest corner of Massachusetts, the Southern Berkshire Rural Health Network saw a chance to care for neighbors in a new way.
It represented an opportunity to do things that we talked about and sort of do them right, not be begging and pleading for volunteer time and such like that. It was also an opportunity to step out of the isolation in this far southwest corner of the state.
As the pandemic arrived, Deb picked up the phone, gathering every agency she could to ask a simple question. What do people need?
The idea was simply to say, what's going on? What do we need? What are we doing? How are we doing it? Who needs help? Who needs support? Who's out there?
Families worried about feeding their children when schools closed. Seniors felt trapped at home, afraid to leave. The network stepped in, quickly organizing meal programs while connecting neighbors to longer-term food resources.
We knew that the children were not getting the meals they were getting in school. So how were we going to replace those? And then we knew that families were not working. So food was the first direction we went in.
As systems stabilized, they found that the community was ready to carry the work forward.
The people who were delivering meals were knocking on doors and saying, we've got only 2 more weeks of this. Are you going to be okay? What resources do you need? And they all came back and said, we feel like everyone's okay. Okay, good.
Then a deeper barrier emerged: transportation. For many, a job or a doctor's appointment was out of reach without a safe way to get there.
So they decided to run a microtransit here in South County with Great Barrington, Stockbridge, and Egremont, were the 3 towns that were identified through this study that the regional planning did as a great place to pilot the concept of microtransit, which is on-demand vans. It runs sort of like an Uber. It was taking people to and from work. We were impressed with the number of people who were using it for work instead of walking 3 miles home in the dark or riding their bicycle on country roads in the dark.
With support from vaccine equity funding, the microtransit program expanded, providing late-night rides that kept people safe and connected to work and care.
The emergency room was very grateful because there was more availability to bring people home from the emergency room.
The work wasn't about quick fixes. It was about building systems that could last.
So I think the consultants are doing a good job by creating a snapshot around the need, but then helping our community to really come up with a plan for sustainability and how that can work for our community.
In a region where isolation is common, the network found that collaboration is the true infrastructure holding communities together.
We do better work and work that is sustainable when we collaborate and we work together and we support each other.
Behind every meal delivered, every safe ride home, and every plan for the future is the quiet, consistent work of connection. It's the work that holds the net together, ensuring neighbors aren't left to face challenges alone.
The work that doesn't get funded is the work of convening. Somebody has to organize it. Somebody has to facilitate it. And it has to be ongoing. To have a way of regularly bringing people together, that you don't get isolated into your own silo, where you start competing with everyone else for resources, instead of realizing that when you work together, the resources double and triple. The same resource does double and triple the work.
This is what it means to care for a rural community.
Our community's health and well-being relies on it.
This is the rural effect. In the Southern Berkshires, neighbors hold the net together, so everyone has the chance to live healthier, connected lives.